We're chatting with Dr. Jeff Edelstein, an oculoplastic surgeon and Executive Vice President for Medical Affairs at American World Clinics. Jeff, thanks for speaking to us today.
Thanks for inviting me.
Our pleasure. Jeff, would you tell us a little bit about yourself and your professional background?
I'm an ophthalmologist practicing oculoplastic surgery in a solo private practice. On the local level, I've been involved with the Southwest Craniofacial Center. I'm a team physician for the Phoenix Coyotes. I've achieved leadership roles with the Arizona Ophthalmological Society. On the national level, I've been a member of the Academy of Ophthalmology's Health Policy Committee, as well as a counselor representing Arizona for the Academy of Ophthalmology. And with the American Medical Association, I've been on the Relative Update Committee, which determines what the values of all our CPT codes are worth.
Well, because of your specialty committee work in Washington, you've had an opportunity to see firsthand the way the practice of medicine is being impacted by outside forces. Based on your experience, what do you see in the future for physicians and for patients in the U.S.?
Well, the future for physicians is that they're going to be very busy. We see a developing trend of increasing patient need with the number of doctors remaining relatively static. And as well as the fact that the United States is going toward a more controlling environment, we expect that physicians will not only remain busy, but also access to physicians may be limited. The rest of the world has solved universal access with the providing government care with or without secondary insurance. And I expect the United States will follow that role.
Very interesting. What attracted you to the American World Clinics project?
American World Clinics offers a chance to have freedom from the institutional and regulatory bias that seems to be constricting our ability to provide care for patients. And it's also interfering with the traditional doctor-patient relationship.
Very good. Would you also elaborate on the role that you're going to play at American World Clinics?
Well, as a member of the staff development group, I think that we can bring in a broad, diverse group of physicians from all over North America and other countries and try and get people who are practicing their best medicine. We want them to bring their A-game procedures to the table, and we want to create an environment where they're able to share their best ideas and translate that into excellent patient care.
Talk a little bit about the medical staff development and American World Clinics' goals for its physician staff members.
Well, we think we could create an environment where physicians can work together because we're providing a turnkey experience where physicians don't have to worry about running a practice or finding patients. So therefore, they can work together and share ideas and enhance the patient experience and learn from each other.
It seems that your staff development concepts are significantly different from what we see in most U.S. hospitals. What makes you think it will work, and why isn't everyone else doing it this way?
The current system in the United States pits physicians, staff, and nurses against each other, and we find that that's simply non-productive. We think that if everybody has the same goals, that having a happy patient is good for everybody involved, that there's no reason that we can't create an environment that works well for the entire staff. For example, Southwest Airlines has an environment where it's relaxed and it's helpful, and in that atmosphere they're able to provide exceptional service, and we'd like to model that in some ways to improve the patient experience.
As a physician with an active surgical practice, how do you see yourself maintaining your own surgical practice while working with AWC in an executive capacity?
I'm a solo practitioner in private practice, and therefore I don't think it would be any trouble at all to schedule around being in Barbados for 1 or 2 weeks every quarter. And this would not only allow me to get down there 4 times a year, but also take the advantage of being able to provide drugs, devices, and implants that may not be available in a more restrictive United States environment.
We've talked a lot about the physicians. Why do you think American World Clinics will be a great patient experience?
I think many people fear going to the hospital, and Barbados is in a relaxed, beautiful setting. And what we'd like to do is make the entire patient experience relaxed. So both for patients and families coming to Barbados will allow them to experience world-class facility with best practices, physicians who are practicing their A-game procedures, and a family experience that is unlike anything they've experienced in any hospital setting in the past.
Thanks for sitting down with us today, Jeff. It's been great getting your perspectives on American World Clinics and physician staff development. We know that you've got a lot of exciting work ahead.
Thanks for inviting me.